St. Joseph Psychiatry Residency program is a community-based program. Our team is comprised of talented residents, dedicated faculty, and an outstanding administrative support team. We have strong partnership with Napa State Hospital, Touro University Medical Group, Kaiser, and VA of Northern California.
Every psychiatry residency program, there's a core requirement of different training facilities. So inpatient, outpatient, specialty rotations. Most of psychiatry now is practiced in the clinics. And this is where St. Joseph's came in. We were introduced by Touro University, and we realized that both us and St. Joseph's were trying to set up two independent training programs in psychiatry. We also quickly realized that if we partnered, we could stand up a really stellar combined program.
There are so many great things that the St. Joseph, Stockton, and Napa experience offers. You do, first of all, get to be in two very different places physically, but you get to see a lot of different patients. Over here in Napa, it's a very strong forensic population, and so you kind of get to see more of the chronic mental illness play out and how you can manage that, versus when you're in Stockton, you see more of the acute problems.
In Stockton, I feel that we serve a very unique portion of society. You get to be able to talk to all different kinds of people and patients, and there's a lot of diversity in Stockton, so that also helps you, connect with different types of patients. A lot of patients don't speak English. These are all very valuable learning experiences.
The future of psychiatry is very promising. Past few years, medical students are really interested in psychiatry, and then the interest for psychiatry is exponentially growing.
I grew up in a traditional Hispanic family. I saw the way that the mental health stigma, along with other barriers, really affected them.
I was born and raised in Vietnam, and after I moved to the United States, I feel that mental health is one of the areas it's very stigmatized to talk about in Vietnamese community.
I really liked the population that we serve. It's a very underserved Hispanic population, which I was looking for in a residency program. There are a lot of migrant farm workers here that we get to treat, a lot of pathology that we see.
Having someone who can relate more and actually understand what they're talking about, and again, understand and navigate those cultural complexities, is a huge, huge benefit.
The population that we see in Napa is definitely different. It's a forensic facility. People here have mental illnesses that are more severe in nature. That's also, a great learning opportunity to be able to figure out how to work with patients like that and connect with patients like that as well.
We have a strong partnership with Napa State Hospital. It provides a unique opportunity for our residents to rotate through the state hospital system and learn psychiatry at the interface of criminal law.
The breadth and the depth of psychopathology that the residents will get to see here in Napa is unmatched. Just right out the gate, they'd be doing risk assessments, prescribing medications, long-acting injectables. And as they progress through their training, they'll have the opportunity to do other treatment modalities like electroconvulsive therapy, group therapy, supportive therapy, dialectical behavior therapy.
I think the most exciting part about being in Napa is being immersed in the psychiatric community, living on the campus in this kind of beautiful natural setting, having all this wildlife and beautiful weather. I think the living situation here on campus is great because, you can just get up and walk down to the units. It's great in the mornings to just take in that beautiful, fresh Napa air.
I feel really safe here. We have these alarms. Find yourself in danger at any point in time, you can just pull this and it'll send an alarm to the hospital police.
The environment makes such a difference, and this is true for anything, and I've been a big proponent of working in spaces and being in spaces that kind of uplift you. Being around the wildlife, when you're walking from the parking lot to buildings to the offices, you do realize that you're in nature. I think it just provides a serenity.
The work-life balance so far in residency has been great. A lot of time to sleep right, eat right, and exercise, and I think those are the three pillars to great health.
I feel grateful to be in this program.
I'm very happy to be here. I feel like I have good training here, good mentorship here.
I feel I made a good choice in ranking this program highly.
And I'm excited for all the opportunities to come.
We have a lot of resources here. This is an excellent training opportunity for them.
One of the best things you can do as a physician, especially in training, is see kind of everything. I think I've been as happy as I was when I matched, I think even more happier now just seeing these things come into fruition.
Residency is an important career choice in their life. We understand that. Our program is tailored towards the needs of the residents. They will be paired with faculty advisors when they join our program, and the faculty advisors will try to work with them and build up a career path when they are studying and training at our program.